and welcome to the Bellingham City Council committee meetings. Today is Monday, September 13th, 2021. We have 6 council members present, and I expect that Councilmember Huffman will be joining us shortly, but we have a quorum. So we're going to move forward. Our first committee and only committee meeting this afternoon, aside from executive session, is Committee of the Whole, but we have a number of items before us this afternoon. So the first item is Agenda Bill 23000. And so this is an update on implementation of interim housing strategies, i.e. shelter, for those experiencing homelessness. Staff from the City of Bellingham and Whatcom County Human Services, with guidance from the Homeless Strategies Work Group, completed a needs assessment that included an inventory of current shelter options operated throughout the county and available to people who are experiencing homelessness. Upon completion of the inventory of services and the identification of needs and gaps, a set of recommendations was created for the Homeless Strategies Work Group's consideration. The Homeless Strategies Work Group approved the recommendations at their April 16th, 2021 meeting. Subsequently, the County Council accepted the recommendations at their May 4th meeting, and the City Council of Bellingham also accepted the recommendations on May 24th of this year. So staff is here to provide a progress update to the City Council. And I just wanted to mention at this point, we are have a full council in attendance. So with that, I will turn it over to Tara Sundin with the City of Bellingham.
Okay, good afternoon. Joining me today is Ann Deacon. I think she's joined the meeting. Ann is with the Whatcom County Health Department. I know you all know her. And she helped present the strategy with me when we were here in May, and she has since provided a similar update to her county council. But I'm also excited because, not excited, but maybe sad, but pleased to celebrate. And this is her last week of work at Whatcom County, serving Whatcom County, and we're just so grateful for everything she's done. She's really moved the needle for our community, and I've really enjoyed working with her over the last probably 3 to 5 years. We've worked a lot together. So anyway, she'll be part of the presentation this afternoon. Your packet contains 3 documents. There's a memo included in the packet from me. That memo really emphasizes the programs and projects that we have initiated since fall of last year, and really emphasizes the work that not just the city and county teams have been working on. Other departments at the city have been very engaged in our Garden View tiny home village, but then as well as lots of other agencies in our community trying to build more capacity and respond to these challenges here that are facing not just Bellingham, but Whatcom County and the entire state. The second is a table that Whatcom County provided to the county council. So it really represents a status report. There's quite a bit of detail on there. I'm not going to show that document on screen, but it's in your packet. And I'm happy to touch on any of those. I think we are going to cover most of them, just in a different format. And then finally, the Homeless Strategies Work Group recommendations, as presented to you in May and accepted by both city and county councils. I do have a very short PowerPoint presentation, and I decided to use it because I don't have too many meetings left with Jean Knudsen, but also because I just felt like this topic there's so much going on that sometimes it just helps to just distill things down to a few slides. So I've got 3 slides to share, maybe 4, and then I'm going to turn it over to Ann Deacon. So we're going to use this PowerPoint to discuss the overarching goals that accompanied all of the strategies, as well as the new capacity that's been created since last fall or will be online this coming fall, new programs and projects that are underway. Now, there's a lot of things that don't happen in the course of a year or a couple of months, but there's a lot of exciting momentum that's going on, and we'll share that with you. And then the final slide that Anne will cover is to continue supporting our existing shelters. So we're highlighting a lot of the new work, but there's a lot of work that we've created as a community over many years that we are continuing. So as a reminder, these are kind of those overarching goals, and I wanted to touch on a couple today, and you'll probably hear us speak to them a couple of times this afternoon. One is to prioritize our most vulnerable. We know that the needs in our community far surpass our ability to resource all of those needs. So that was one of the clear areas of focus was let's make sure that we prioritize our most vulnerable. And you've heard me, and we've talked, and you've allocated resources to families with children a lot more this year than has ever been needed in our community. Another one that we want to make sure we don't lose sight of is investing in long-term permanent solutions when things start to get tight. So you'll see us present today, and we're going to continue to recommend that we carry out the programs and projects that are included in today's presentation. But I will tell you, and I've talked a bit to Councilmember Hamill about this, we've done a preliminary look at the 1590, looking at the county's funds and the city's funds. And we're starting with Samuel Lutz and I and county staff, and starting to look at where we might allocate those for your consideration. And I will say that we are starting to see some tightness. What you'll see presented today is not all funded. And so we need to make sure that we have adequate funds to carry out what we think are these priority projects before adding new, and making sure that we continue to invest in the solutions that are going to get people out of crisis response, out of shelters, and into housing. So new capacity since last fall. As you know, Homes Now, with the help of the city of Bellingham and Whatcom County in the purchase of the tiny homes, has added capacity. They're currently located at Jerry Field. My team with Parks Department and Public Works, and it seems like quite a few departments, are working with Lehigh and Road to Home to bring online Garden View. That will bring another 36 tiny homes for our community. These tiny homes are going to help us with capacity at some of our existing shelters. So remember, these tiny houses are considered shelter, not the low barrier, congregate shelter, but this is just still our kind of a stop in what we're hoping to achieve, which is to get community members into permanent housing. And then pleased to report that in your packet, it said 30, because that's what we had last year, but Bridget Reeves confirmed that there will be 40 low barrier shelter overflow beds operating in Old Town. And if you recall last winter, they didn't need to operate this shelter as frequently as they had planned because base camp was not at capacity, but they had committed to a 3-month shelter, which was very similar to what we've done in years past with Fountain Community Church, or when we operated a women's shelter with the Opportunity Council for the months of December, January, and February. This year, they are expanding their gift to our community and including October, November, and March for severe weather shelter. If you recall, last November, we did have a severe weather event before the overflow was open. And so Christ the King is providing this service to our community. They had over 100 volunteers trained up, and they are working on kind of reinvigorating that training schedule. They've got a lot of interest from their the community in operating this. I will point out that if it were not for the expertise that the Lighthouse mission brings to this program, Christ the King would not be comfortable operating. So they work in partnership with Base Camp. Base Camp staff send guests that they think would be a good fit for this shelter, a good fit for the volunteer program, but Christ the King also has hired staff. So this is a fully staffed program and will be operating for 6 months, this year. Another project, it was in the list, a young adult shelter. What we've been working with Northwest Youth Services on is creating more capacity by relocating the specialty shelter that we have for teens. It's referred to as the PAD. Their goal is to relocate that program into a neighborhood that's more suitable for that age group, for their learning and growing and recovery. And then turning their existing PAD location, which is on State Street, adjacent to 22 North, into a shelter for young adults. This program will as well help relieve capacity at Base Camp. So I know both the director of the mission as well as Northwest Youth Services agreed that for these 18 to 24-year-olds, having a separate shelter for that age group, also focused on recovery, would be beneficial. And they're also seeing some opportunities for connection to 22 North, as that is kind of the next step for some of those community members in that age group, is to move out of shelter and into 22 North. Oh, I wanted to mention on this slide, it didn't, Anne reminded me, you might recall that the YWCA added 5 emergency shelter beds last winter, and they're upping that with the county's financial support to 10. So there will be some more beds there as well. All right, so this is, I think we dedicated a whole session with you focused on families with children. And since COVID, we have found that there are more and more families with kids seeking help, seeking assistance from our system. And before COVID, we just had small amounts of money to shelter a few families during the winter months of December, January, and February in motels. That has expanded. We have had, fortunately, resources coming from the federal government to help us expand that system. And so we continue to do that. We also, though, were concerned that the system's kind of jammed up and we don't have enough movement. And so we asked the council for some additional funds and resources to focus on case management and rental assistance, which we have ramped up. So opportunity for me to just mention workforce as a concern that the city, county, and the agencies are seeing. It's taken them a little time to find people to fill these positions. But that program's getting ramped up. The purpose of case managers and the additional rental assistance is to move people through the system. We need to get those families into housing. Unfortunately, we'd like to get them moved into housing and not have a need. We're still seeing a need for continuation of the motel stay program. The third bullet there, so we've kind of got, multiple strategies all focused on families with children. We're seeing this as probably the highest community need right now that we should be focused on. And the city staff, and I asked Katie Sullivan to join today. She might show her face. She is new to our department. She was hired to help us with housing and homelessness, and she is helping me with this project. This is a partnership right now funded by the Mount Baker Foundation, partnership with Whatcom County, the Opportunity Council, and Lydia Place. And we are starting the needs assessment feasibility analysis of not only constructing a new facility, but operating a new facility. And the facility would be a purpose-built facility that was designed and built with a programming to support families with kids. The next one down, and I will say that is like a big project. That's like a legacy project. And we think we might be able to tackle that one because of the amount of federal recovery funds that both the city and the county are getting. You're going to hear more from us on those funding opportunities at your next meeting. Medically fragile. This is a facility. It's a pretty amazing program that Unity Care and Peace Health and Whatcom County have come together to create. It's called the Way Station. It would be a respite shelter for up to 20 guests. So right now, the mission at Base Camp has a few beds for people that may be coming out of the hospital and they don't qualify really to stay in the hospital, but would be unsheltered. And so this is a facility that would come with the personnel to take care of people a little bit longer. The other thing that they're talking about doing with this facility with Way Station is having another place for our unsheltered community members to go to do laundry, to take a shower. So other services, health services as well. And this is a particular project that they're not seeking city funding for. And then finally, I already mentioned that young adult shelter. We are hoping that shelter will come online this fall. It is contingent upon a successful purchase by Northwest Youth Services for an alternative location. And shelters for teens are highly regulated by the state, which is great, but there is a licensing requirement. Again, they're moving as quickly as they possibly can. Again, a lot of these programs that I've mentioned, especially with the families with children, young adult, looking at rental assistance and case management when our federal monies are going to go away, right? We're not going to have recovery funds forever. And so one of the challenges that we've got and that we will be working with you on is making sure that we allocate that 1590 or move resources around, which is always something that we're working on, so that we can tackle and create these permanent, well, these aren't permanent solutions necessarily, but permanent facilities and high quality shelters. And then I'm going to turn it over now to Ann Deacon.
Good afternoon, everyone. For quite a few years, the county has supported specialty shelters throughout our county and focused for the most part on permanent supportive housing solutions, knowing that the solution to homelessness is indeed housing, not shelters, but housing. What we have found, obviously, in the last couple of years is that we needed to dedicate more resources just to the shelter aspect of serving our populations who do not currently have homes. And with that, we also know that for us to balance out the resources we have, we really need to ensure a continuum of services. So if we overinvest, for instance, in shelters, we may not have enough to actually move people out of shelters into permanent housing. So we continue to balance out the funding and resources available to make sure that we continue to move people through to permanent housing. We do have over 500 shelter beds currently in our community. And I think when we presented last spring, we showed you an inventory of all those shelter beds. So that's fairly impressive for a community our size. Obviously, Tara's talked about the tiny home villages, Base Camp. What is interesting about Base Camp is last winter, when there was a lot of vitriol and misinformation going around about Base Camp, it was not fully utilized. Now that that has kind of subsided, the misinformation and vitriol is really not able to take a front and center stage in our council and open public meetings, that base camp is now fully utilized. And I think that's something for us to think about this coming winter, just in case protests or other, unless there's a repeat of what happened last year, which again, I would hope that the council can really take a stand to ensure that you minimize misinformation, vitriol, denigration of our resources. That was a horrible thing that happened last year. And as a result, a number of very vulnerable people who were pressured to stay away from base camp were in very challenging situations and suffered some fairly significant abuse and assaults. So that was very troubling for us. Obviously, one of the things we're working on over the next few years is to get base camp to their permanent location in Old Town. And I know that base camp has, Lighthouse Mission Ministries is certainly spearheading a campaign for dollars to help support this. And in the meantime, in order to decrease their current expenses so that they can put as much as possible into this new permanent location, the county has been providing significant funds to help offset the costs of their current operations. A couple other things I want to just mention kind of on my way out, because I feel a need to really emphasize some things that we have learned. One is that in our point in time count, which happens once a year in January, we found that about 30% of those people experiencing homelessness did not have their last permanent residence in Whatcom County. So with that, what that means for us is that we have a number of visitors. Obviously, that is not new, but that the percentage is fairly high. It used to be more like 10%. Over the last few years, it's risen to 30%. What that means when we're doing our planning is that we really need to consider then the most appropriate shelter options for those who are visiting our communities. There was a lot of push last year, for instance, for tiny homes. We would recommend against tiny homes for visitors, for instance. A drop-in type setting is probably more appropriate. We also know that base camp regularly receives drop-offs from transports from medical facilities, institutions, etc. At times, they've even had a Skagit County law enforcement vehicle marked show up and drop people off. So what we also know is that our facilities here in Whatcom County have become regional facilities. I don't have to point out to you that those regional facilities we're offering are not without regional support or financing. It's all local right now. So again, what that means then is we really need to be very cautious and thoughtful when considering the establishment of more shelter capacity. How do we address the issues and truly the drivers of this increase in homelessness? Obviously, you're aware of the federal challenges that the East Coast and West Coast certainly see a lot more people who are experiencing homelessness. The I-5 corridor certainly has a higher concentration. But for us as a community, we need to really relook at working with our regional partners on this issue. For me as a social worker, when I hear that people experiencing homelessness have to leave their communities just in order to find shelter, I don't see that as particularly humane or kind. And that I would urge you as a council to look to partnering more with regional counties to make sure that we address this in a much more effective way. And just building more shelters, all that means is that we invest more in shelters. It means we have less for the solution to homelessness. So these are really complex issues. I just felt the need to really emphasize them today so that we don't get pulled off track by what we feel is an emergency. Homelessness is not an emergency in the sense that it has been happening for quite some time. That is not to say that it's a good thing. It's a very bad thing, but it is a chronic issue that we have many strategies to address and try to address that. I think at this point, I will leave it to questions from you about what else we may be doing. Currently, I will tell you that the county dedicates right this year over $16 million to this issue of homelessness, as well as some affordable housing, trying truly to build and invest all along the continuum of care, from shelters to outreach and support to rental assistance, obviously case management for people who simply cannot navigate or find their way into their first apartment without help from people who are our case managers. We've got a great community, a wonderful sense of obligation to protect our residents, and I want us to be as thoughtful and strategic as possible as we do this work. So I'll open it up to questions unless I missed something, Tara, that we were going to present.
The only thing that I would add that might have gotten missed is Whatcom County Health Department did try to find additional severe weather operators. We were only able to secure Christ the King. So I wanted to make that clear with you that there are not other agencies in our community that are willing to come forward to do more and more night by night low barrier shelter service. But we are fortunate that a community our size does have night by night up to, over 240, 50 beds available.
Thank you. It is not for lack of trying. We have reached out pretty much weekly. I think in part, COVID was certainly a concern last year when there was no vaccine available, and a lot of our volunteers were older. And so obviously they did not want to put themselves in danger, and we weren't interested in pressuring them to do so, of course. And I think, again, there are still some concerns about that. Plus, to be quite honest, providing shelter, even if it's a warming center, it requires a certain level of skill that not just every person with a good heart will have. You have to ensure the safety of everyone. Otherwise, you risk liability to the city, to the county, and obviously to the people that are trying to use that facility as a safe location. So we don't just set up shelters without ensuring that we can provide safety and security.
Thank you very much to both of you, Tara Sundin and Ann Deacon. I know that Ann Beck is with us as well. I mean, I know we have other presentations this afternoon, but before opening it up to council, I just wanted to make sure that Ann Beck and or Katie Sullivan didn't have anything to add. I know that Tara, you'd mentioned Katie's work, and I know that she's new to the team, and so just having that introduction and name and a face is great as well.
I was just going to confirm what Ann had said. We did reach out to some folks, and I had somebody who was interested in doing shelter. It was a non-faith-based organization, but they just, at this point, with the rising cases of COVID and safety, it just became more than they could take on at the time. And then we also reached out to the Faith-Based Ministries Network, created a video, question and answer, sent that out. I heard from a few folks, but it's just capacity of everybody is a bit challenged right now. So we haven't had any luck securing that extra layer.
Thank you for that follow-up. Katie, do you want to take a moment just to, I don't want to put you on the spot, but just to introduce yourself?
Of course. Thanks so much. Hi, everyone. It's nice to meet you all. My name is Katie, and I'm a relatively new employee with the city of Bellingham, working in the Department of Community Development and Planning under Tara, focusing mostly on issues of affordable housing and homelessness. And I look forward to working with you all, and it's nice to meet you.
Thank you so much. Yes, welcome to the team, and we're glad to have you with us. So I will open it up to council questions. We'll start with Councilmember Anderson.
Thank you very much. I will have a couple of questions, but I first just wanted to make a comment. First, Ann Deacon, thank you so much for all of your years of service. I know these kind of comments usually come to the end, but I just wanted to recognize the reality that the past year was extremely difficult for so many of our employees and partners, given, as you had put, the vitriol of a lot of the comments and the impacts on our homeless population because of that. I greatly appreciate the work you and Tara have done. I know I have made multiple comments about what is our plan B. And I'm thankful to hear that we have been reaching out. I'm sorry to hear that a non-faith-based organization has not stepped up, but I fully understand it is not due to the lack of effort on your part. I also wanted to comment, I'm extremely thankful that Christ the King has stepped up and increased an additional 6 months. I think the coverage from October to March will be very essential, and it does plug some of the holes of the concerns I've had, that especially with last November with the inclement weather situation, we just didn't have something ready. So many thanks for being able to expand that offering. And I will yield at this point. I'm sure other people have questions, but I'll raise my hand shortly for those. But just wanted to acknowledge that you guys have done tremendous work, and it's very much appreciated. And thank you again for expanding an additional 3 months for the inclement weather drop-in. It will definitely be life-saving for many.
Councilmember Vargas.
I too wanted to start with a thank you. And the city owes you a huge debt of gratitude for the work over the years. Your heart, your caring, your diligence, your sticking to the facts and saying it like it is wonderful. And this relationship you have with Tara, this is one of the best relationships that we have with the county, is with the health department. And I really acknowledge that is a lot to do with you and your participation and your leadership. So thank you for that. I was curious, I know our point of time count was significantly higher this year, and a lot of these plans talk a lot about Northwest Youth Services and relocations, et cetera. And I'm wondering, in that time count, was a lot of our increased numbers youth? I'm kind of curious because it feels like we have a big focus on that, which is great, but I'm wondering if it's because it's a much bigger need.
I think what we were trying to do, so let me answer two questions first. One is that the point in time count did not see a large increase in the number of unsheltered people who were experiencing homelessness, but overall it did. And a lot of that was related to the increase in families with children. And we also knew that we can't just put everyone and anyone into base camp, that there are special needs of certain populations. And so in order for us to relieve the pressure on base camp, we've been focusing on other populations that our qualitative data collection told us were needed in order to spread the wealth, if you were, and also to ensure that people had the best response to their situation. I hope that makes sense, but it was really all those moving parts.
And just to clarify, Pinky, we're not adding more beds for youth. We're relocating the youth shelter so that we can add more beds for young adults. So there's the minors, youth, and then there's the young adults. And I believe that Northwest Youth Services has had a long wait list for that kind of age group. And right now, that age group is either in base camp, and they do have services during the day at the ground floor, which is kind of like a day center. But this would allow them to actually have some night by night beds, but also secure some beds for young adults that is a little bit more than checking in night by night, a little more transitional to get them to the next step.
Councilmember Lillquist.
Thank you. I've got a couple questions, so I'll just start with one and ask to be recognized again. Again, I want to start. Thank you, Anne, for all your years of service, and welcome aboard, Ms. Sullivan. You'll be doing important work for us. I appreciate it. So I didn't think that the Homeless Strategies Work Group was done with its work. But that said, the work group did serve to really sharpen focus on areas where there was need. And as Anne put it, let's relieve the pressure on base camp as a drop-in center, because it isn't suitable for every population as a safe alternative. And so, for example, the work group identified the need for shelters for medically fragile and elderly. And I really appreciate the fact the way station is on board. And I believe that Road to Home has future plans to being able to serve some of this population too, maybe not as intensively as the Unity Care Northwest. We also identified the fact that youth were vulnerable, particularly LGBTQ youth and other people who don't feel safe, again, because they're young and vulnerable in that general drop-in setting. That was an identified need, and I love seeing that that's being progress is being made on that front. Northwest Youth Services has a queer youth project. They're very much aware of the needs of those young people who unfortunately experience homelessness at a higher rate than other people do. And then the final area we identified, or one of the areas we also identified, is family housing. And in particular, I've been talking more and more over the last 6 months, maybe longer actually. Hard to tell with COVID. You can't tell how long anything is anymore with COVID. Talking about purpose-built family housing. Okay, so now I'm going to get to the question. What can I do as a council member to support that purpose-built family housing project coming faster? Or what can members of the community do to speed that up? What resources, what partners, what offers of support, what can we do to move that idea forward more quickly to feed into the process in a beneficial way?
Thank you for that question. One of the things that the council is going to be able to do to move it more quickly is to allocate some Federal Recovery Act dollars towards it. We think that this is not a tax credit type project. This is below that. It's not going to have a revenue stream coming off of it. But we do have this kind of, I don't know about once in a lifetime, but close to it, opportunity to do something big and bold. But we will need dollars from the state of Washington. I think this is going to be a very exciting project for them to participate in. So your help there could come in handy. And then we haven't identified who the operator is. This is one of those, I'll take a minute to, you'll notice that this project, typically the city staff or the county staff aren't leading feasibility analysis on a specific project, but we're stepping in because our agencies are tapped out right now. So this has been on the radar for a while, and I've heard about it for a while. So it was like, let us help relieve the pressure, but we got to do the feasibility work. We have to make sure that we have an operator that can go. I think this will be easy to construct. I think the tougher nut is to make sure we have adequate resources to operate these facilities. That's where the rub's going to come over time is, and I do think with 1590, we have that opportunity. So with federal recovery and your leadership on 1590, I think we're going to be able to make serious progress on that project. But you're going to have to sit tight a little bit longer because we're just starting that feasibility work. Also, finding sites we might need your leadership on. So stay tuned. Site, we'll start looking at sites at the beginning of the year. Our first step is to make sure we know what size facility we should build, look at best practices out, not just in the state, but nationally at what's working really well, figure out our programming, and make sure we have an operator that can be successful. Then we'll launch into looking at sites. Thank you.
Councilmember Huffman.
Thank you. So first of all, I've been a card-carrying member of the Ann Deacon fan club, I think since I saw you speak, Ann, at a city council meeting once, and I was just absolutely in awe and floored with your knowledge and your passion, and sad to see you go, but I'm very, very grateful that you've given your service for so long to this community. So thank you. So I'm really happy to see such a focus on specialty shelters, and that's we're increasing capacity in that realm. I think that is a wonderful way to go. And I'm wondering, with the new tiny home village Garden View, which sounds like it's right around the corner, the residents of that village, who will be moving in, and how will those residents be found?
They are, so at one point in time, we talked about certain populations, and we've kind of backed away from that, being a little bit more flexible. They are currently working with our Homeless Services Center, and they've started meeting with base camp personnel to identify guests of base camp and those on the wait list at the Homeless Service Center who would be the right fit. Remember, the Garden View is going to come with 24/7 staffing, but also case management. So we can have a little bit lower barriers at this particular location, if that kind of helps. So other than that, though, I could get a little bit more detail and send it off to council if you would like, but they're working through that, making sure it's fair, but also that the right people are sent there so that they can be successful.
Councilmember Hamel.
Hey, I've got some prepared comments that I want to read, and this is an acknowledgement for Ann and her work. So just give me a minute here. Ann's been a leader for improving our community and people's lives for her entire career, one that's lasted for over 50 years. She's made Bellingham and Whatcom County better by helping to create programs like Grace and Lead. I spent months with Ann and others, and Tara and others to help create those programs. So I know what that looks like to build those things from the ground up, and those programs help people every day. And she brings hard-fought solutions like the Crisis Stabilization Center and the upcoming alternate response team that's going to be the unarmed response for Bellingham for certain types of behavioral health calls. For years, she's managed the PETA model, prevention, intervention, treatment, and aftercare, that has helped countless people and their families who are struggling with mental health illness or substance use disorder, or both. Since the beginning, Ann was a leader on the Incarceration Prevention and Reduction Task Force, helping to guide policy and policymakers in the best solutions for our local residents. Ann is both a mentor and a peer to me. We've traveled to San Francisco, Philadelphia, and Washington, D.C. together on a MacArthur Foundation grant that she helped to secure. Whatcom County and Bellingham is one of a handful of communities that received that grant. And I'll never forget being with Ann in an office on Capitol Boulevard in DC, negotiating the final funds for the Crisis Stabilization Center. I knew at that moment that she was my mentor. Ann, I want to personally thank you for your commitment to making our community a better place to live. I wish you and your family the best in retirement, and thank you for your guidance and wisdom. And I'm going to stop there because I'm getting very verklempt and choked up. But thank you, Ann. You're the best.
Hear, hear.
I'm very appreciative of Zoom meetings right now, because I don't think I could do this in person. I am truly grateful. Let me just say that working in this community is my highlight of my career, simply because of the relationships and the commitment and the sense of community. People are problem solvers, and that's what it takes for these really difficult issues. And it's been fabulous, and I'm ambivalent leaving, but I'm sure I'll define myself again.
Councilmember Knudsen. You're muted, sir.
I just want to thank Ann also. I've been listening to Ann for years and years and years. And one of the reasons I always felt confident in what we were doing during all the protests, during all the screaming and hollering. I knew inside that we were going to be fine because Ann was always been there. She always has been there for us. So I wish you nothing but the best too. And Whatcom County is going to be, we're going to sorely miss you, but you've laid in place a foundation that needs to be picked up and carried on. And I'm sure with Tara and everybody on both sides of the street, it'll be taken care of. And when you look over your shoulder in retirement, I'll be right behind you. So thanks, Ann. Oh, I did have one question for Tara, though. I'm sorry. Tara, with the Northwest Youth Services thing, we're already hearing and getting some phone calls from people in the Ridgemont area that know this is a possibility. And I've been assuring them there's going to be many meetings, many times for them to ask a lot of questions. They were being told it's a done deal, it's going to happen tomorrow, and you know how that happens. But I'm sure everything will be done the way it's supposed to be done.
Yeah, so Northwest, some of you were on council when I think Rick Sepler brought this forward, the interim housing code. And small shelters, those that have fewer than 16 or fewer guests, can go pretty much anywhere in the city with pretty straightforward process. And that was done on purpose. I mean, we finally have a shelter site for base camp after 6 or 7 years, and it's because they control it. But that was done on purpose, was to get, these small shelter strategies is to make them happen quickly. And so what comes with that, though, in that code is a requirement that the operator has kind of a good neighbor program where outreach and communication's a requirement of it. So there will be, but it's not one of those, those shelters aren't, let's have a public meeting and you tell us if you want it or not.
Yeah.
Yeah.
Thank you.
Mm-hmm.
And Deacon, did you want to respond?
From a programmatic point of view, council member, these are young teens that are seeking safety and refuge, not seeking a place to get into trouble. And so it truly is a different population. And I think the more we can help the community understand who truly will be using this facility, I think that will allay some of their concerns.
Councilmember Anderson.
Thank you. Just a side comment. I was on the Planning Commission when that change came through, and it was very widely supported because we do need to have our transitional and homeless services spread out throughout the community. And really, when I read this, I was so happy to hear that we had an agency stepping up and utilizing this. And I do think they're going to be a wonderful model for communities to be able to cite, much like when the first tiny homes came in to a neighborhood. There was a huge uprising and concern, but all those fears never manifested. And then the community was very supportive, those neighborhoods, once that, their time was done to move on. So I feel really confident that Northwest Youth Services is going to have a wonderful facility, and the folks and neighbors who are concerned will come to find out that they probably won't even know they're there. And because I'll probably now get an email, I would state, yes, I would be very happy to have them be my next door neighbors. So it's not a put it over in someone else's neighborhood. If the house to my left went up for sale and they were able to purchase it to site this, I would be baking cookies and taking it over there to welcome them in. So yes, you can put it in my neighborhood. I would be happy and supportive, but that wasn't why I had my hand up. And thank you, Anne, for acknowledging that 30% of the people who are currently houseless are transient coming into the community. I think there's, in the past, a lot of the information was that a majority of people were Whatcom residents, and talking with a lot of our emergency service personnel, they were very informative that a lot of individuals they were working with didn't live in Whatcom County, a month or two ago. And I think the protest downtown was very illuminating because some of the organizers were doing videos of who were residing there, and a vast majority of the individuals were stating that they had come from someplace else just a month or two prior. So it's been a concern of mine that we are a regional center of services and that other counties are not necessarily doing their part. And I brought that up during May. And so thank you for addressing that. My question is, where do we go from there? I know that it's going to have to be the mayor, the executive, perhaps county and city councils will be involved, but what would be the next step? I personally don't want to be a regional center, because if a lot of people come into the community, they may be receiving services, but they're also, it's going to be very difficult to get the funding. And we're extremely generous and we have a lot of money going to services, but there's also consequences on our businesses and impacts. And I'm afraid, because I am hearing it already, that some of our citizens are very frustrated. They have the impression that we're not doing anything. And my fear is that we don't have the financial capital to do enough to take care of multiple counties, especially when you hear law enforcement from another county is bringing people to us and leaving them at our door. And now we're spending our city funds and county funds in order to assist them. So do you have next steps, or is that something that's going to be worked out in the coming months for us to hopefully help address this? I do want to be able to provide services, but I also want to make sure that we are able to provide all the other services a city and county need to provide with the limited funding that we have available.
I appreciate that. And I typically don't tell my bosses what to do, even during my last week of work. But I will say that I do think a regional meeting with county leaders is probably timely, just in terms of, first of all, taking an inventory. What does each county have to serve their populations? And then what is needed? And also to maybe start to figure out how to incentivize our neighbors to do something for their own residents. And I think, staff could start that process, but I really do think our elected leaders are going to have a bit more influence in having that regional meeting. Certainly staff can provide critical information and data to help with the discussion, but I believe it's in the hands of our county leaders.
Does Sat Paul have that information?
I am sparing no words my last week. What the heck?
Yes, please.
I assume I won't get fired this week, so I should be okay.
Councilmember Lillquist.
Well, I have now three things because I want to follow up on what Ann said, but I'll go with the one I was going to go with first. Ann, I think you said that the county's budget for housing and housing services this year in 2021 is $16 million. The city's is $22 million. A lot of that's one-time money and money carried forward, but 9 of that is annual recurring money. That includes the 1590, so it's larger than ever before. How much of the county's $16 million is also in that annual and recurring category, and how does it compare to previous years?
Going off the top of my head, I think maybe we have somewhere between $6 and $7 million that are ongoing. Some of that is not just housing dollars, but we do divert or allocate almost $1 million out of our behavioral health sales tax, for instance, as well as mental health millage, as well as veteran millage and other sources to help support housing efforts. And that's not counting the new $1,590 or $1,406 that we've gotten.
So you said about 6, not including those two sources. So it might be more like 8.5.
I think that's reasonable.
I had seen Councilmember Hamill's hand, but you no longer have a question.
Oh, I'm trying to figure this out, just like all of us, and to see Anderson's point about the 30% churn that we have, that's a real issue. So I sit on the biweekly base camp calls. I'm the council member that does that. So I listen to the calls. I listen to PD. Last Wednesday, the executive from base camp reported that 3% of their nightly new residents are from somewhere else, from a mental health institution or somewhere else, not from Whatcom County. So do the math. It was 196 people the other night. So 3%, that's like, 5 or 6 people every day that show up that are from somewhere else. I'm not confident in Skagit County or Snohomish stepping up to want to build facilities there. Why would they when we're doing it for them? I don't know what the answer is. I'm very frustrated. And it's not that I don't want to serve people. That's not the point. The point is that we have limited resources in our community, and we can barely serve the folks that are here. So I want to figure this one out. I don't know if any of us are on the Swiss, if that term is familiar with you. That's the Snohomish, Whatcom Island, San Juan, and I forget what the other S is. Skagit. So I don't know if we have representation there, but perhaps getting a conversation going. But I remain unconvinced that they will put one step forward on anything if we're doing it for them. So I don't want to sound harsh, but that's my perspective. I want to make sure that we're serving people that are that we have here that need the help and get them through the system into housing. That is the ultimate goal. It's not to shelter people indefinitely; it's to help them. So I just wanted to say that. I don't really have a question. Thanks.
Councilmember Lillquist.
Thank you. If we get to the point of turning that last issue into a motion, I'd be interested in that. Something about engaging nearby counties. This is probably an administrative executive level discussion at this point, right? But I think it's an important discussion. So I would take Ms. Deacon's direction on that one. My question has to do with the winter shelters. You could see the problem coming last year in November, right? And I'm glad we're better prepared for it this year. I want to refloat an old idea that no one bid on. We offered to help pay for supporting a safe parking program. And I'm wondering if that idea was broached again. Safe parking programs are basically, if you're living out of your car, you can come to this parking lot. There'll be some welcoming, some comfort, some restrooms, but you don't live there. Your car leaves every day. And what I'm thinking is this is kind of a lower commitment level potentially for winter sheltering than turning over your building. And it's also maybe more COVID safe if people stay in their cars rather than shelter together in the facility. For winter parking, not for a permanent solution. Was safe parking broached again? I don't know if Ann Beck is still here. I don't know if Ann or Tara, you want to speak to it. Is that idea totally dead? I know we tried it and no one said yes, but it's worked other places.
It's not something that we've looked into, but at the same time, safe parking might not be for winter season, might not be as effective just because it's still outside in the cold. Folks might not have access to the heat, which is probably one of the main reasons we didn't look at that one. And I do want to, just because we worked really hard in 2019 on this, 2019 winter season, we did successfully have the multi-layer shelter seasons happen. We created ample space and it was successful. And then the pandemic hit and we lost a lot of resources and capacity. So I just always want to make sure that hard work that went into that on behalf of this community is recognized for that year.
Thank you, Ann. Councilmember Anderson.
Thank you. I kind of wanted to circle back about the hotel motel vouchers. I think we spend a significant amount of money on those hotel vouchers, and I'm extremely thankful that we've had good partnership to be able to house some of our vulnerable residents and families with children. It just always seemed to make sense to me that we should buy a hotel instead of construction I know other counties and municipalities have done that. And Teresa Muir, bless her heart, has sent us multiple emails in the past about advocating that that would be a great pathway to go forward. And I'm wondering, it always seemed to make logical sense to me to purchase a hotel or motel in order to provide the housing for the families, and then we could have intensive case management at one location instead of multiple hotels, and then use some of the hotel voucher money for like supporting the long ongoing cost of the staffing and resources of partnerships and perhaps running it. And I'm wondering, has that been part of the discussion, using some of the federal funds that have come forward to be able to utilize something like that for a purchase?
So as part of our feasibility analysis, we're going to take a look at best practices. And I will make sure that this particular idea gets discussed in that realm because it keeps coming up and we know some communities are doing it. However, when this idea first came surfaced to me from those that are working with families with children, a hotel room is not the best situation. In fact, it causes, if it was, Lisa, I think if we were at the situation with really we were just sheltering families for a few nights or a couple weeks, maybe a single bedroom with 2 beds in it without adequate cooking facility would be okay. But that's not what's happening. And so it's the families are staying too long. So my response to that is, well, if the agency is working in that arena on a day-by-day basis, don't think it's a good setup, then I don't think we should buy something to how for the solution. Now, perhaps maybe that model would work well if we got to the point where we had families taken care of and we could go to other like singles or, a different demographic. But to answer that question, though, I'm gonna bring it into that group. We're starting to work on Wednesday on it, and I'll make sure that it's considered as a best practice.
I'm also thinking, as far as construction cost, the purchasing of some of the motels that could potentially be on market with a renovation to knock out a wall and be able to, put in a galley kitchen would be, my understanding, a lot less expensive than a brand new build construction. So, thinking creatively that if it doesn't necessarily fit, because we don't want families in one little room for a long period of time, even being able to purchase something that has most of the structural elements in place with a renovation cost to make it more feasible and livable for families, that might be a good direction to go. Because they are staying, to my knowledge, in hotel rooms for quite a while because we don't have the housing. So the reality is they're there now. So taking a look at the cost perspective over a 5-year period, are we further ahead with that purchase cost, renovation, and management that would centralize those services? Just something to throw out there.
We'll take that into consideration. A potential retrofit, could that meet the needs of this population? Sure.
So I have a question following up on the families with children. Those numbers that we continue to see increase, do we have any insight in order? I'm assuming that the case management and rental assistance, right, is geared at trying to prevent that from happening. But I'm just wondering what chance we have of increasing that capacity to catch things before they're showing up at the shelter or seeking that temporary housing, because we all know how much more difficult it is to replace someone rather than hopefully keep them where they are. And so I'm just curious if that's through coordination with the school district or Opportunity Council. Like, are there any indicators, I guess, where we know ahead of time, like, this person's about to be right, moved out of where they're currently staying and showing up, or are we only able to sort of meet them where they're at when they show up seeking assistance?
Well, there is, you know, 16, 20 some $million coming in rental assistance to keep people where they're at. So that is definitely something the Opportunity Council is working on, is making sure people stay in their housing. So that is happening. The city, because we have some more flexible funds, even before COVID, had kind of a prevention model. So we have a contract with the OC to prevent people from becoming homeless, to make sure that we can get them what they need to stay in their housing. But we're looking at needs assessment at the beginning. And so why don't I take that back to my team to see if there's some other ways that we can, because it's better off for the families and the community and the resources to keep people housed, for sure. I think a lot of families were doubled up. And you would hear that from the school district. There is a lot of, they sometimes refer to it as couch surfing. And so, I mean, that's something we're trying to address too, right? Instead of having people doubled up. I'm hoping though that while we're planning this new facility, we start to make real progress on getting people out of the system and into housing, so that it's not 70. We're not building a facility for 70 families. That's not what we're hoping to do.
Another follow-up question was related to the drop-in center and Christ the King and that expansion to cover those that additional time from October to March. And I just missed the clarification about where Christ the King would be operating. That's not at the drop-in center. It would be at a separate location. Is that?
So that's a good clarification question there. It would be operating at the former drop-in center in Old Town, whether they used to have before they called it base camp, that was the shelter. It's already set up. They've got restrooms and better facilities. And so that's where it will be. And they will use, I can't remember whose shuttle, but there will be a shuttle service that goes from base camp down to Old Town and back.
Okay, great. So I have lots of other smaller issues that can be discussed at another time. I guess in closing, the last issue that's been raised by a number of council members and was sort of big on my list was what Anne and you have both mentioned with respect to the regional concerns, right? Branching out to include Whatcom, Skagit, Snohomish, San Juan, and Island counties. And I have that concern even regionally, just within Whatcom County, right? As we see the needs grow, not only do we not have the resources to meet the need regionally, but also even if we did have the resources, I don't know that centrally locating all of the people needing shelter and services in Bellingham, would be the best for Bellingham as a whole, and trying to figure out how to meet people where they're at. And so I know that Councilmember Lilliquist was looking for a potential motion, and I see Mayor Fleetwood as well. So I'll recognize Mayor Fleetwood first before going on.
Thank you. I just want to speak to that observation that's been raised today about the need for regional partners. This is something that has come up in a number of different contexts over the course of recent months, and it's very appreciated and well understood. I would mention, as it relates to the Swiss region, quote unquote, Executive Sadu has spoken to that. I've heard him mention publicly the fact that he is part of a group of county executives that meet with some frequency. And I believe he's spoken to this issue before. I have a meeting coming up with him soon, and I will make a point of sort of putting this item on the agenda and sort of reasserting, expressing the view of our council about the need for not being just the one location seemingly in the region that has such a robust effort put forth on these issues, that we need to have far more people in our region stepping up as well. It's also come up in a number of the mayor's meetings that we have with a couple times a month. rather prominently a couple of months ago. I remember that when we were talking about potential uses of federal money, American Recovery Planning money, and how we could use that, and whether or not taking some funds and creating more balance so that we had places where people could go in the existing cities within just our county. So this is a very prominent notion. And I will make a point of underscoring it when I speak with Executive Sadhu, because it's worthy. If I could make a comment about, in response to Councilmember Lillquist about safe parking, we made a real effort in that regard. I know you recognized that last year. Former Director Sepler was involved and spoke to that on a number of occasions. I believe that we had a period of time at which we were waiting for responses from the community. I think at one point we made a decision to even extend that time period, and we didn't get any responses. One of the thoughts at that time was that perhaps it had something to do. This was sort of at the height of COVID and the approaching COVID winter, and we thought that that might have been a basis for some reluctance. So whether that's something that we might want to explore considering again, I'll certainly talk with planning staff about that and see if there's any feasibility to it. Finally, I just want to thank Tara and Ann for the presentation today. We are undoubtedly, demonstrably in a better position than we were a year ago. And I just want to thank you for that, because that was quite a fraught time, as we all know. And we are all committed to going into this next season in a better position. And I'm confident that we are. So thank you for that. Finally, Anne, I just want to join in all the kind remarks towards you. It's a little bit scary. We go into this with a bit of trepidation when somebody as seasoned as you is hanging up their cleats, and it's a little bit scary. You're going to be missed, but that's the nature of things. So we wish you all the best.
Councilmember Lillquist.
Appreciate Mayor Fleetwood's comments there. Just to close the loop, I would like to make it a little bit more formal on the idea of bringing up the topic for a multi-county discussion on these resources. Can we at least maybe get like head nods from the council? I would like the mayor to know that he's on a pretty firm foundation with all council members, not just those who've spoken to it. So I don't know, Councilmember Stone, how you want to handle that, but I would like the mayor to know that he has 7 of us or 6 of us, behind him on this.
What's your motion?
I just want to see head nods. I just want you to know we got your back.
Okay. Thank you.
Thank you.
I see unanimous support. Thank you.
Thank you for that. And I think, going forward, I appreciate what Andy was saying. And I think Councilmember Hamel mentioned, the concern that, what's the motivation and incentive when you talk about sort of incentivizing, what's the motivation for other communities to line up to help when it feels as though the work is already being done. I have some cautious optimism. I recall very vividly, because I made a note and it has stuck with me, that Councilmember Ellen Boss at one point was speaking to the fact that he didn't, he had some frustration with all of the funding always going to Bellingham, and why didn't some of that funding go to the small cities and out in the county for shelter services and other projects. And so I feel like the need is definitely there, but the approach is key. So I would definitely support us starting at home within the county, and then going to the region to try and address that together. So thank you all very much. And to Ann Deacon, once again, we are very indebted for your years of service and so appreciative for the guidance you've provided. And you've left us in good hands. But like the mayor said, we're apprehensive and a little nervous, but I'm sure we're going to do fine, because you've laid some great groundwork. So best wishes to you in your retirement, and hopefully our paths will continue to cross, but in different veins where we're not, you're not having to come to council to speak to these issues. But thank you so much, Anne, and best wishes.
Thank you very much. It has absolutely been a privilege.
Thank you. And thank you, Tara, for your time in the presentation. I'm sure there's more to come, so we'll say to be continued, but thank you very much for the update. All right, so moving forward this afternoon, the next agenda item is Agenda Bill 23086. So this is consideration of interlocal agreement with Whatcom County for a homeless communication strategy. So the interlocal agreement provides funding for reading communications to work in partnership with the City of Bellingham, Whatcom County, and local community organizations to gather information, develop a communications strategy, and create a resource toolkit to be used as needed to inform and mobilize the community about the challenges and solutions regarding homelessness in Whatcom County. And for this, I will turn again to Tara Sundin.
Just real quick, the city and county staff, and I think all of you have recognized, it is such a, it's a big topic, and we're doing a lot to address homelessness. And sometimes it's hard for us, especially we're the doers of the agency, the project managers, the getter-doners, and then the communication piece gets lost. And so I think this will really help us and help you be able to educate and inform the community. And we just feel like it's such a big issue that we could utilize a little bit more resource to focus on it. So it will be shared. And Councilmember Lilliquist brought up both of our funding sources. We coordinate so well and so much with the county because our sources of funds can sometimes do different things. So we wanted to work together. It's like one whole system and work together on this communication strategy.
Thank you. Councilmember Knudsen.
Move approval.
Second.
Motion's been made by Councilmember Knudsen and a second by Councilmember Hamel. Any discussion or questions from council? Okay. Seeing none, all in favor will say aye.
Aye.
Aye. Any opposed or abstentions? Okay, seeing none, that passes 7-0. And so moving forward, the next item before us is Agenda Bill 23092. So this is a proposed ordinance accepting a donation of Hillside Estates storm